Thank you so much, Dr. Lettieri, for another great presentation. So I'll start with the first question. If I take a 60 to 90-minute nap in the afternoon, do I go into my second phase of the natural sleep cycle when I go to bed at night, or does the nighttime sleep begin with the first phase of the sleep cycle?
Yeah, it only works if you live in Spain, where they have siestas. No, so really the question is, we'll break it down to this. Do afternoon naps, are they bad? Or are they good? And then I'll jump in to answer the question best I can. As I point out in that circadian rhythm, we have a normal lull in the mid-afternoon, and a lot of societies have adopted a siesta. Interestingly enough, the rates of cardiovascular diseases are significantly lower in countries that have siestas. But remember, they also have altered their entire circadian rhythm to fit the optimal sleep-wake cycle of humans. Where more Western countries have really kind of pushed more for productivity, where we start work very early, we work all day, we go home, we pass out, we get up and do it all over again. So if you take an afternoon nap and then you try to go to bed at 10 or 11 o'clock, well, you're not adapting to that normal circadian rhythm that they would have, say, in Spain, where they get up at 9 a.m. And if you remember back to that circadian rhythm, you really don't start waking up until about 9 a.m. Well, they get up later in places like Spain. They work briefly, have a long lunch and then a long siesta. They have dinner much later in the evening. They're not eating at 6 or 7 like a lot of people in North America do. They're eating at 10 o'clock at night. Remember, where we had the period of greatest vigilance was late in the evening, right before we would normally go to bed. And they go to bed at about 12 to 1 o'clock, where their body has a great drive for sleep. So it's a little different than if you just take an afternoon nap and otherwise try to stick to that 10 to 11 to 7 sleep period. The reason being is, well, you get rid of all the adenosine you've just spent half the day accumulating. And so will it impair your ability to fall asleep? It might. And if you do fall asleep, will it also impair your ability to attain normal sleep architecture? And it might. So when we go to bed, we usually transition to N1 sleep and then right to N2 sleep, and where we get most of our N3 sleep in the first 2 hours of the night. So people who take an afternoon nap actually have a marked decrease in the amount of slow wave sleep, that N3 sleep. That really is the most important sleep. That is the coma-like sleep that's going to restore your body, actually help consolidate some memory. And without that, depression, weight gain, more injuries, slow recovery time on injury, more pain, and less muscle mass. So is it bad to nap? Probably not. Is it bad to nap if it's if it's fragmenting your sleep architecture? Absolutely. So, but the real question I always tell people is, well, when they ask, is it okay to nap? The first question is, well, why do you need a nap in the afternoon? Why are you having a hard time staying awake during the day? Are you not getting a sufficient amount of sleep that night, or do you have an impaired sleep quality? Because most people under the age of 65 should be able to stay awake all day if they're getting good quality at night, sleep quality at night. The reason older people tend to nap more in the afternoon is because, unlike a fine wine, we don't improve with age, neither does our sleep. And we have more impaired sleep, more sleep impairments the older we get. Not only are we accumulating more aches and pains and more medications that can fragment sleep, but just our normal sleep architecture changes. We get less slow wave sleep the older we get. The less slow wave sleep we have, the worse sleep quality, and so the less restorative functions there are of sleep. So that's why it's very common for older people to need an afternoon nap. So for everybody on the call, if you're napping in the afternoon, ask yourselves, why do you need it? Can you improve your sleep quality or quantity at night? If you are getting good quality and quantity at night and you just do well with an afternoon nap, then it's not bad. Just make sure that you adapt your sleep-wake cycle accordingly. If it's taking you more than half an hour to fall asleep at night, get rid of the afternoon nap. As long as you feel that you're getting good sleep quality, that's the best you can hope for, but you are probably diminishing your amount of slow wave sleep. I hope that answers the question.
Okay, great. This next question is a two-part question, so I'll read the first part. A lot of teens and young adults are going to bed between 2 and 3 a.m. Does their sleep cycle begin with the first phase of sleep, where the first half of their sleep is primarily N3 sleep, or are they going straight into the second half of their sleep cycle?
Yeah, so it's a really interesting question, right? So if we said a normal sleep wake cycle is 11 to 7, and I said the slow wave sleep occurs in the first couple hours of the night, that would really mean before 1 a.m. So if I go to sleep at 2 a.m., did I skip that? Well, interestingly enough, the body always wants slow wave sleep. The body will do whatever it can to get slow wave sleep. So whenever you go to bed, if you stay up late, you're going to go into slow wave sleep. The later you stay awake, the faster you'll go into slow wave sleep. The more sleep deprived you are, the more slow wave sleep rebound you're going to have. So usually you're not going to miss your slow wave sleep. You're not going to stay awake through the time. Slow wave sleep is a more of a reflection of how long you've been asleep rather than what time the clock says. REM sleep, however, is probably a little more dependent on clock time, but still, in the second half of our night, we'll get more REM sleep. If you set an alarm, but it's normally we set an alarm too early and we miss REM sleep because we get up before it occurs, rather than we altered our sleep wake cycle. So if you're awake long enough, you should get into REM sleep. If you get up too soon, most of us truncate our sleep by getting up too early. And then you can miss your REM sleep then. So yeah, it's a great question. Usually, no, you're not going to stay awake past your normal circadian slow wave sleep. You're going to get slow wave sleep no matter what. But you're right, most teenagers stay up late, and that's just very common. We call it delayed sleep phase syndrome. It's just a normal thing for young people, not only teenagers, but young adults, to want to go to bed later and sleep later. Unfortunately, school starts early in the morning. School start times are not based on physiology for teenagers or children, but based on when adult parents have to go to work. In the U.S., actually, I've worked with a lot of, not myself only, but some task forces I've been on, where we have been able to work with school systems and districts to delay school start times. In fact, in one place in Virginia, we delayed the high school start time by an hour. We looked at grade point averages, graduation rates, SAT scores, and actually, interestingly, number of motor vehicle accidents in the area all improved just by letting teenagers go to school an hour later. Still not sufficient. They probably try to get 2 hours later, but small victories start somewhere. So, unfortunately, we see a lot of people in clinic, teenagers who are struggling in school. It's not because they're bad students, but because they're asleep for the first 2 hours of the day. Either they come to school late or they're at school, but they're unable to focus because they're still sleepy. So understand that, your teenagers are more prone to staying awake late. There are a lot of things that are contributing to that more so than ever. And a lot of it has to do with screens. So those LED screens are the perfect wavelength of light to suppress melatonin, and they're staring right at them, right up to the point of bed. There's more social interactions and way better video games than when I was a teenager. So it's very easy to, over time, just continue to get used to a later and later and later bedtime. Teenagers need 9 hours of sleep per night. You got to figure when are they leaving for school in the morning, and they've got to get enough sleep before that. I know it's tough. Sometimes it's tough to be a parent, but you got to get your kids enough sleep. And turn off the lights and turn off the screens within 2 hours of bed. But to answer the question, no, they won't miss their slow wave sleep.
Okay, and I believe you've already answered the second part of the question, but I'll just read it anyway. If they do still sleep for the 8 hours at this 2 to 3 a.m. Timing, will they still have the benefits of a full night's sleep, although their time of sleep is skewed?
Yeah, well, sure. Well, let me answer that two ways. Sleep is all about quality, quantity, and timing. So you need enough quantity of sleep, right? You got to get a sufficient amount of sleep. 6 hours of great sleep is insufficient. You need a good quality sleep. 10 hours of crappy sleep is not sufficient, right? So are you able to go to bed, fall asleep, have good sleep efficiency, good sleep continuity, nothing's waking you up, no sleep apnea, no medications, no dog, neighbor, cat, spouse, whatever that's fragmenting your sleep? Are you getting normal sleep architectures? That's the quality part. And then there's timing. right? So you saw the sleep-wake cycle. There's times that the human body is supposed to be awake and times the human body is supposed to be asleep. And that's more important with things like shift workers. So if you're up all night, you're up when the body's supposed to be asleep, and then you're sleeping when the body's supposed to be awake. Well, the body's supposed to be awake. And it's very hard. Remember, I told you at the very beginning, sleep and wake are mutually exclusive. You have to turn on sleep and turn off wake. Well, if you've been awake all night, you're going to be tired enough. You're going to have enough external sleep drive that you're going to pass out. But the body, the circadian part of you, is saying it's time to be awake. So your wake is on. You're not turning off wake. Wake is on while sleep is on. And then people who sleep during the day have much worse sleep quality, worse sleep efficiency, more wake after sleep onset, and a decreased sleep architecture than people who sleep at night. So if you're going to bed at 2 a.m. and sleeping till 10 a.m, you're not exactly aligned to that normal sleep cycle. But if you think about those places with siestas like Spain, you're not that far off. So maybe a little bit diminished because they are awake or asleep when their body is trying to wake them up, but it's probably not that bad. The bigger issue is, well, how are they, getting to school if they're sleeping till 10 o'clock? So right now we're in the summer and kids are staying up later and sleeping later, but at some point they're going to have to go back to school, and it's not the day before school when they can reset that. Imagine if you go on vacation to 2 time zones away, you're a little sleepy. 6 time zones away, you got a lot of jet lag. Imagine going 10 time zones away, right? The further you get away from your normal sleep wake cycle, the harder it is to adjust, but over time you will adjust. If you move to Korea, it's going to be completely inverted sleep wake cycle. They're 12 time zones away. But over time, if you're there long enough and you go to bed and get up at the same time every day, you will eventually adjust and phase shift your circadian rhythm to that new time zone, right? So just like a teenager or anybody who makes themselves used to staying awake later and later and later, you will phase shift your circadian rhythm to your new sleep-wake cycle. Unfortunately, teenagers do this, or kids do this historically over the summer. They get used to staying up later and sleeping later, and then they rapidly snap back their sleep-wake cycle to getting up to go to school without a sufficient amount of time to phase shift themselves back. My recommendation is you have a regimented sleep-wake cycle, everybody, kids and adults, where you go to bed and get up at the same time every day, 7 days a week, 12 months a year.
Okay, thank you. Next question is there a difference in symptoms between people lacking REM sleep versus delta sleep?
What was the last part of that?
Is there a difference in symptoms between people lacking REM sleep versus delta sleep?
Yeah, probably. So there was one study done in the 1970s where they took healthy college students and they REM deprived them, meaning that they came and slept in a lab, and every time they had REM sleep, something poked them and woke them up. And the plan was to see, did it impair academic performance? Now, I always want to know what idiot, thought getting $25 or whatever they paid them to see if some intervention impaired their academic performance. I don't know what college student would do that, but yet they did it. And what they found was after 2 weeks, the majority of them were depressed. And in fact, they had to shut the study down because somebody was suicidal. At the same time, some independent people were doing the same study in rats. They were REM depriving rats, and rats died. They died very quickly if you're REM deprived. So in REM, it's part of our memory consolidation. Without REM, we tend to get very depressed very quickly. Less impairment of sleeping, so in slow wave sleep, we do consolidate memory there. So more cognitive impairments, more physical impairments, more sleepiness without slow wave sleep, more behavioral health, more. So we lay down neural pathways in slow wave sleep. We consolidate memory in REM sleep. So they have both important for memory, but in different ways. Less recall, decreased cognitive performance with less REM sleep, more behavioral health issues with REM sleep, more physical impairment, and memory laying down new memories with slow wave sleep. More weight gain with less slow wave sleep.
Okay. So what happens to shift workers? They will often have about 6 hours of sleep in the daytime if they work during the night. Is their daytime sleep equivalent to nighttime sleep, or is the quality of daytime sleep poorer?
Yeah, as I mentioned before, it is poor. They have less sleep efficiency, meaning they wake up more. They have more fragmented sleep. They have decreased sleep architecture, less slow wave sleep, less REM sleep, and it's more than just like so. Really, to have healthy sleep, you want a dark, quiet, comfortable sleep environment. And if you're sleeping during the day, it's brighter, it's warmer, there's more external noises. So right off the bat, you have a lot of external factors that are impairing sleep. But again, a lot of it comes down to two other things. One, the circadian rhythm. Your body's trying to tell you to be awake and you're trying to force sleep. And the other thing, think about what daytime workers do. You get up in the morning, you blast yourself with light, turn off melatonin, drink some coffee, go to work, and then at some point, I got to stop drinking caffeine. I'm not blasting myself with light before I go to bed. I get in dark, quiet, comfortable sleep environment, and I'm good. Well, think what night workers do. They drink coffee all throughout the night to include the early morning hours because that's the greatest propensity for sleep. They drive home in the bright sunlight, and then they try to jump into bed. Or think about it. You get up, you brush your teeth, you go to work, you come home, you do some errands, you go to bed. Shift workers tend to do errands on their way home, right? So they're already truncating their time in bed. There's external time, external cues that fragment sleep architecture or sleep quality. There's all that, the light, the impact of light on melatonin secretion and caffeine and wake promoting substances. And then you're fighting your circadian rhythm. So shift workers have lots of reasons why they have impaired sleep quality. The other thing with shift workers is they will gain 5 to 7 pounds more. A person who's a habitual shift worker will gain 5 to 7 pounds more than a non-shift worker. Again, they just like people with chronic death, there's higher divorce rates. There's an increase in all-cause malignancies. Originally, it was breast cancer because the studies were done among nurses, and at the time they did them, most nurses were women. But we found with all shift workers, there's an increased risk in colon cancer, breast cancer, and lymphoma because of the potent antioxidant effects of melatonin. There's more peptic ulcer disease, and there's about a 3-fold increased risk in hypertension. So fatter, unhealthy, more divorce, more cancer, and more cardiovascular disease. So don't be a shift worker if you can avoid it.
Okay, thank you. Next, we have a request to discuss strategies for fragment sleep architecture in menopausal women.
Yeah, that's a tough one. So there's a lot of issues that go along with it. So even normal women during their normal menstrual cycles, during the follicular and luteal phase, will actually have the effects of estrogen and progesterone actually alter sleep. And so there's periods where they're more somnolence from the progesterone and more insomnia from the estrogen. And as you go through your normal menstrual cycle, most women are unaware of it, but they will have more daytime sleepiness and more impaired nighttime sleep at different points of their menstrual cycle. And there's those women who either have a greater impairment of that or are more aware of it, is a thought to be an association with PMDD. Now, as you become perimenopausal and menopausal, you have multiple issues. So not only are you having greater variations, day-to-day variations in your hormone levels as things are changing that are going to lead to more insomnia, more hypersomnia, depending on what part you're in. But as you start having primary ovarian failure, you start having more insomnia, more pain, more hot flashes that can fragment sleep. Those can go on for a long period of time in a lot of women. And it's very hard to know when those, start and stop. The other thing that happens is there is clearly a protective effect of estrogen on upper airway motor tone. So premenopausal women have a much, much lower rate of sleep disorder, breathing, sleep apnea than men. Postmenopausal, they actually have the exact same percentage of sleep apnea as men. And so it's during that perimenopausal period when they lose their estrogen and now start getting sleep apnea. Well, sleep apnea, sleep fragmentation, daytime sleepiness. Well, that is very hard to say sometimes. Is that from your So, what we say with sleep apnea is waking up sweaty at night, getting hot at night, having to pee at night, fragmented sleep, and daytime sleepiness. Well, that's exactly what happens to a lot of women just from normal hot flashes or perimenopausal symptoms. So sometimes it's very hard to tell what's just menopause versus have you now developed sleep apnea. So something to always think about among women, if they tend to have prolonged experience, if they're experiencing perimenopausal sleep symptoms for a long period of time, they may have developed sleep apnea at that point. It's no longer menopause. So, estrogen replacement does improve sleep quality, and it has been shown to reduce the effect of menopausal symptoms at the risk of being on hormone replacement. Interestingly, antidepressants will improve subjective sleep quality in perimenopausal women, but not objective sleep quality. Unfortunately, it's one of those things that there's, other than looking for sleep disorder breathing, there's not much you can do other than just giving it time. There was one small study looking at Lunesta in women going through menopause, and they actually had markedly improved sleep quality, better daytime function, and less depression. So a lot of my patients who are starting to have a significant insomnia related or sleep fragmentation related to menopause, I will put on a course of sedative hypnotic therapy. I tend to be a minimalist when it comes to sleeping pills. I try never to use them. If I do, it's only for a week to 10 days, sometimes 2 weeks. But for women going through menopause, I will do it for 3 to 4 months and then try to stop it.
Okay, thank you very much.
Dr. Chris, is there any validity in looking at the total sleep time that a patient has and look at their total time of stage 1 and stage 2 sleep and be able to make a diagnostic comment with regards to them being more vulnerable to things like cardiovascular disease and those kinds of things?
Yeah, so absolutely. I would say, always take caution with the results of a polysomnogram. So when we look at sleep, what is sleep efficiency? It's the amount of time asleep divided by the amount of time in bed. So you want that as close to 100 as possible. If you're in bed, you want to be asleep. And so we look at, total sleep time and wake after sleep onset versus total time in bed. So your total time in bed is total sleep time plus wake after sleep onset is your total time in bed. You want that to be as close to 100% as possible, as little wake after sleep onset. You want a little bit of slow waves or N1 sleep, about 40% of N2 sleep. And you want as much slow wave sleep as possible. So 20 to 25% is about normal for young adults. You want as much as you possibly can. There's been a lot of people who've looked at different ways of enhancing slow wave sleep. Bodybuilders will try to expand their sleep. Gamma hydroxybutyrate was all the rage, for bodybuilders. And then people use it recreational to try to increase the amount of slow wave sleep. But in the end, it really looks at there's no really effective way for us to say, what is your sleep efficiency? But yes, the less efficient your sleep is, the more wake after sleep onset, the less slow wave sleep you have, the more N1 sleep, the less N2 sleep you have, the more vulnerable you are to developing cardiovascular disease. But there's no real way for us to measure that. We can measure it readily in a sleep lab, but that's an artificial environment that in and of itself can fragment your sleep. And obviously one night is meaningless. It's really, what are you like every night? And nobody lives in the sleep lab. There are some devices, more wearables that are trying to measure our sleep efficiency. Obviously none of those are very accurate, but it gives you an idea, right? It gives you an idea of how efficient your sleep is. Are you having fragmented sleep? And I think, if we look at that as a warning sign for some patients to say, hey, your sleep quality isn't good, you're increasing your risk of cardiovascular disease, I think those are important. So I think it's a great question. Unfortunately, there's, in the academically, yes. Practically, no, there's no way to really measure that. I hope that answers your question.
Thank you so much, Dr. Lettieri, for joining us again.
Thank you.
Excellent, informative talk. And we hope to have you back again one day.
Yeah, you guys have a great evening.